And we are live.
Welcome everyone to the 12th COVID-19 CommunityResources.com Town Hall meeting, powered by the Center for Closing the Health Gap. I'm your moderator, Cincinnati City Council member, Jan Michelle Lemon-Kearney. Today we're going to talk about two topics that really make a lot of people uncomfortable. So we want you to really listen up, ask questions. We're going to talk about Alzheimer's, and we're going to talk about organ donations. Two topics that kind of scare people. And so we really want you to be informed about both of these. Of course, I've got to, before we get started, thank our tech team. We've got John Reichel and Lauren Harden making sure that everything works out well. Also want to remind you that we are being recorded because we will post this session later so that people can actually see it, those who missed it. Let me introduce our panelists, and after I just tell you briefly who they are, then we're going to give them each a few minutes just to make a few opening remarks, and then we'll get to questions. So you can see the Q&A. If you're on Zoom, there's Q&A right there, and you can even start typing in your questions now. If you're on Facebook, you can put in your questions and we will get them as well. So we are ready to get started. So panelists, as I think people can see your names, I'm never quite sure. So just as I call your names, just kind of wave so that people know you. We've got a national health columnist for the Black Press, Dr. Anisa Shomo, and she's got her own column, Dr. Shomo Knows. She's fantastic, lots of great information. We're always happy to see her. We also have Dr. Orson Austin of UC Health. We have Mr. Trey Addison, who's State Public Policy Director for the Alzheimer's Association. We have Mr. Keith Mitchell, who is a board member for the Alzheimer's Association. And we have, and I should say, so that group is going to talk about Alzheimer's, and now the second group that I'm going to introduce you to will talk about organ donations. So we'll start with Andrea Johnson of the LifeCenter Organ Donor Network. Dr. Kent Robinson, I know is, and he's of Mercy Health and the Cincinnati Medical Association. I don't see him, but I know that there's a little tech issue that we are working out, so Dr. Robinson will be here. We have Sarah Green Moore, okay, and she's going to tell us a personal story. We also have Idris Gray, wave Mr. Gray, and he's going to tell us a personal story as well. So welcome all of you. We're so excited that you're here. Let's start by just having some remarks by each of you. We'll start with Dr. Anisa Shomo.
Hi, everybody. So I'm Anisa Shomo. I'm a family medicine physician. Also, I'm a geriatrician. I work for University of Cincinnati / the Cincinnati Health Department. And I'm here today to talk about Alzheimer's and caregiving for patients who have dementia. And the first thing I would say is that Alzheimer's, a lot of people don't know what that means. So it's the type of dementia. And so sometimes people think, that they have memory loss, they have Alzheimer's. But there is a clinical diagnosis that we make. We do a series of tests to diagnose it. So first of all, don't be worried that you have Alzheimer's, because usually people who are worried about it are people who don't have it. It's usually people whose family members are bringing them in saying, I'm worried about their memory, are the people who we are talking about. So that's why they require a lot of caregiving. And the Alzheimer's Association has tons of great information for how to direct caregivers during these times about, staying in the hospital, staying at home, what kind of questions you should be asking everybody who's coming into your house. So be sure to check that out. But that's what I'm going to be talking about today.
All right, thank you. All right, next, Dr. Orson Austin of UC Health also.
Oh, thank you so much. I'm so happy to be here. I am also a geriatrician and a family doctor for UC Health. We have an outpatient office in Tri-County and a medical director at Maple Village Retirement Community. Today, Dr. Shomo has already spoken about some of the things that we have an interest in, but today I was asked specifically to discuss COVID-19 as it relates to the nursing home community. So I will address some questions and concerns that family members should ask or be aware of if they happen to have a loved one in a retirement community or a long-term care facility as it relates to the COVID-19 pandemic.
All right, thank you so much. Okay, Mr. Trey Addison,
Yes,
Policy Director.
thank you. Thank you. And Trey Addison, State Policy Director for the Alzheimer's Association. We represent over 200,000 individuals living with Alzheimer's and dementia, as well as the almost 1 million caregivers across the state. We do that at the State House as well as the federal level. And now we're starting to do actually some work in West Virginia also. Most of the work that we're doing at the state level, it really comes in 3 phases. Testing was a big issue for us, just to wrap it around COVID-19. To Dr. Austin's point, when you look at the nursing home perspective, if we had to catch a baseline on testing staff and looking at where the baseline was to be able to be proactive. So we worked with the governor to do that. The other 2 issues was really reporting, making sure that we were getting the right reporting out from different facilities, long-term care facilities, et cetera, as well as just from the general community. And the third aspect of this, and I think this is a great topic and a great discussion today, is looking at the sort of disproportionate results, especially among seniors, especially of individuals living with Alzheimer's and dementia. What does that look like in the midst of COVID-19, and especially in the African-American community, where we know early detection and early diagnosis is a struggle. Families across the country really are dealing with this in the midst of a pandemic. So excited to discuss this topic with you all and look forward to the conversation.
Thank you so much. Okay, Mr. Keith Mitchell.
Good evening, everybody. My name is Keith Mitchell, board member for here in Greater Cincinnati Alzheimer's Association. And what my job is within the board is to help connect the community to the resources of the association, as well as helping to lead fundraising efforts. So here on this panel today, I'll be following the esteemed doctors and Brother Trey Addison, who are the true experts. My job is simply to fill the gaps for anything that they may not have time to cover. So it's a pleasure to join you guys and happy to be a part of.
All right, thank you so much. Okay, so we're going to switch over to organ donations before we start taking questions. So let's start with opening remarks by Andy.
Hi, and thank you again for
having. I'm calling her Andy. Andy Johnson.
Andy is just fine. I'm Andy Johnson, and thank you for asking us to participate on this panel today. I am with an organization called LifeCenter Organ Donor Network, based here in Cincinnati. I've been there for about 15 years as Community Relations Director. And we're just happy to have this opportunity to talk to the community today about organ, eye, and tissue donation, to answer any questions, dispel myths. As we know, there's many myths that exist that we need to talk about and have a dialogue about and give people the facts so that they can make an informed decision about registering to be a donor. And then we'll also talk about just how people of color are suffering at a disproportionate rate from the coronavirus, and how people of color are also suffering at a higher rate from diseases that can ultimately lead them to needing a transplant, specifically a kidney transplant. Currently, there are about 114,000 people in this country waiting for a life-saving transplant, and more than half of those individuals are people of color who are in need of kidney transplants. And so we're gonna dial in and talk a little bit more specifically about kidneys and kidney transplant today. So thank you again for inviting us to be a part of the panel.
Thank you so much. Thank you so much, Andy. Let's go, let me just check and make sure Dr. Kent Robinson hasn't gotten on yet, because I would take him next. Okay, he's still getting on. Okay, that's fine. Sarah Green Moore, you have a personal story to tell us. Why don't you tell us your story?
Well, yes, I do. I call myself one half of the whole. because when I received my kidney transplant almost 3 years ago, I ended up with people call my kidney sister, because we received our kidneys from the same donor. Transplant took place the same day. Transplant took place at the same time, and we've been connected at the hip ever since. So if it wasn't for the selfishness of the family, not only did they save my life, give me the gift of life, but they also gave me Renee. So I got a 2-for-1 in that.
Wow.
I got 2-for-1. Yeah.
That is beautiful. And we'll talk later about, before I start asking you questions, I'm going to let Mr. Idris Gray speak a little too, and then we'll talk more about that, because that's a powerful story. Mr. Gray?
Yes.
Want to share your story with us?
Yes. Hello, everyone. I'm Idris Gray. I am the founder and CEO of Progression Works LLC. It's a motivational speaking service, and our motto is progress is a process. And, with everything that's going on with COVID-19 and the protest and, the rioting or whatnot, we have to understand that we need to, really progress in society. And I'm blessed that Andy Johnson asked me to be on this panel today to give my perspective about what I go through as a kidney patient, a lifelong kidney patient, because it's that much of a commitment. And I received my kidney in 2015 after 4 years of dialysis. And, the grueling dialysis, everybody knows who's been on it, it's trying. But I was blessed in 2015 to receive a kidney. And I work closely with LifeCenter as well as National Kidney Foundation in order to be an advocacy for people who are, not aware of the particular diseases Andy mentioned that, can really cause kidney disease and kidney failure. And so I'm that much, blessed to really be a part of that mission. And especially in these days and times with COVID, even though you may not have it, even though you may not contract it, just the anxiety behind it, causes, your immune system to go down. And, after everything I've been through, I became a certified health coach as well, just to, help people and, give them information and, be a shoulder, for them to, really rely on. So like I said, I'm just blessed to be here. I'm not going to go any longer. And, thanks again.
Okay, well, we will get back to your story, because I'd like to hear more about that. We do have some questions. Let me just start. We're going to start with the Alzheimer's panel. So the first question is, what exactly is it? And so this person had said to me, if like I forget my keys, I forget where my car is parked, I might forget, an appointment. Are those early signs of Alzheimer's?
Alzheimer's is a condition caused by the development of protein plaques, amyloid plaques in the brain. And it's a disease that ultimately will affect your ability, your cognitive ability, and your functional ability. It's distinct from age-related memory loss. We all forget our keys and where we placed our keys. That is not Alzheimer's dementia. Unless you're having some sort of progressive functional decline, can't write checks when I previously was able to. I get lost when I'm driving. Those are some of the type of things. And usually family members or people who know you well can pretty much tell, hey, this is more than just age-related memory loss. There's something going on. So.
Okay, well, thank you. That's really helpful. And Dr. Shomo, let me ask you, is there, I should say, a behavioral change? Because I'm just thinking about my aunt, who used to be really gregarious and was always telling jokes and great stories, and she just became really quiet. I mean, her whole personality changed, and she was diagnosed with Alzheimer's. Is that common?
It is pretty common because a lot of times people will start to realize that their memory is kind of slipping and that they are changing. The other thing is that sometimes people are depressed. So there is a condition called pseudo-dementia, where we will try to make sure depression looks different for older adults. we have a whole completely different depression screening tool that we use, where we just ask people, are they having meaning in life? Are they bored all the time? So just trying to ask them about depression, because that can definitely cause a lot of changes. But then sometimes as people realize that they can't do a lot of the things that they used to be able to do, they can start to, be a little sad. So sometimes people can have dementia and depression. But one of the biggest things we always try to do is make sure that it's not just depression, because sometimes it is, So we look at all of that very closely and to make the diagnosis of Alzheimer's or any kind of dementia. There's different types. Parkinson's sometimes can look, people can have their facial expressions be a little different and not having as much range of emotions and that sort of thing. So there's different types of dementia as well.
But the key is that something seems really wrong. It's not just like, oh, I forgot this appointment, or, I left my keys and, forgot where I parked my car. Okay. All right. So let me, there are a few more questions that came in earlier, but some are here now. So let me ask this one. And this person is anonymous, and attendees, you're free to put your name in if you like, but if you want to be anonymous, that's fine as well. So the question is, I have read that Blacks are twice as likely as whites to be affected by Alzheimer's. Do we know the reason for this? That seems really high, twice as likely. Wow.
Yeah, I'm not sure of that number, but I would say that if that were the correct number, I would make sense, because one of the biggest risk factors for developing Alzheimer's are chronic diseases such as hypertension, diabetes, heart disease. So all of those things that Black people, that disproportionately affect Black people as far as cardiovascular disease, are going to be risk factors for developing Alzheimer's.
Yeah, and I would say Dr. Shomo is absolutely right. And one of the things that we've seen at the association, just from a macro standpoint, is really early detection and working with families at the front line, a lot of times with the doctor, and saying, hey, we understand something's going on from a memory standpoint or from a mental perspective, and having those real conversations. And a lot of times, if we're not detecting this early enough, and you just let it go on and let it go on, let it go on, it just naturally gets worse. And I think it's one of those instances where we've worked, and we're still going to work on this in Ohio at least, is to put some sort of a training legislation in place to where doctors and nurses who are on the front line have the ability and understand, okay, what are we looking for if this individual has Alzheimer's? What does that mean? How do we educate the family? Which a lot of times that's an education process within itself. Just the research shows, and to the individual's question, research shows that the conversation among African Americans when it comes to Alzheimer's and dementia is a lot different than those of other nationalities. And I think a lot of it is sometimes we do just say, oh, it's just a memory, you just forgot your keys, or you just forgot this, or you forgot that. Grandma's fine, or dad's fine. Don't worry about it. And the reality is it is something going on, so we can't just kind of blow it off.
That's, and I think you touched on this next question as well, and you might have answered that, but let me read it. So the person says, I understand that there's a push for an Alzheimer's state plan in the state legislature, and how would that help Ohioans dealing with the disease? And so
absolutely, yeah. That was, so Governor DeWine actually signed that into law. That was earlier this year. And what it was is Senate Bill 24, and essentially what it does is establish a task force across the state, really with a laundry list of stakeholders, from long-term care facilities to the Alzheimer's Association and others, to establish a state plan for Alzheimer's and really go at this issue from a resource standpoint at the administrative level, and also look at training and other areas where we can equip the state as a whole to be ready for the surge. And the reality of it is this: in Ohio, the numbers are going to get worse before they get better. And there is no cure for Alzheimer's and dementia, as well as it's the most expensive disease within the top 10 chronic diseases. So, because you're preserving life. So when you're preserving life in some of these settings, that patient a lot of times outlives their loved one or their caregiver. So when we think about that, this is a very expensive disease. We've got to address it as a state because we're an aging state. Everywhere pretty much in the state, but really central Ohio, is aging. And when you look at out of the 200,000 individuals who are living with Alzheimer's and dementia across the state, a good portion of them are living in Southwest, Northwest, and Northeast Ohio. because those are aging areas of the state. So as we look at that, we're excited to work with the governor, as we always have been, to just put together a good state plan that'll help Ohio. And more in particular, one of the things is the state minority, the Commission on Minority Health is actually a participant on this task force. We lobbied for that during this process to make sure we address these issues.
Oh, that's fantastic.
Can I just say something really quick, Jan?
Oh, sure. Please jump in.
So one of the things, so there's two things. One of them is that, you know, as people age, their risk for developing Alzheimer's or any type of dementia increases. But I think that sometimes people think that that is just what happens. So if it runs in your family and somebody develops Alzheimer's, you just kind of are like, well, I guess I'm just going to get Alzheimer's and everybody's going to get it, without really realizing that you can prevent yourself from getting it. So I think that, you know, as I said, you know, the risk factors are diabetes, hypertension, heart disease, all those sorts of things, which you can work to manage. So one of the things that I've done is I've taken, so as part of UC is we do a lot of learning collaboratives and that sort of thing. And so one of the things that I learned is that, you know, we need to aggressively manage people's blood pressure. So that is one of the things that helps with people not having to have kidney transplants, as well as aggressively managing blood pressure. But one of the things that they have shown is that aggressively managing high blood pressure, making sure that people's blood pressures are less than 130/80, when I'm saying aggressive, helps to prevent Alzheimer's as well. So there's a lot of things preventative-wise and treatment-wise that we can do in our diet. So exercise, eating healthy food. So there's a lot of preventative things that we can do in changing our culture that can be helpful for preventing Alzheimer's. So that is some policy, you know, information that we need to work on. But also, as doctors, we need to work on aggressively controlling people's blood pressures.
You know, that's the first time I've heard that, because usually when people talk about preventing Alzheimer's, I mean, my understanding was there's nothing you can do, and I am just so encouraged to hear that. So that is, you know, like managing our health, and this is what the health gap talks about all the time. The blood, you know, the hypertension, you know, diabetes, diet, healthy eating. I mean, those things actually mean a lot, and those are lifestyle changes we can all make. And now that you've mentioned it in terms of preventing Alzheimer's, I mean, that's really encouraging. That's fantastic. There's another, okay, this question says the Alzheimer's Association states that this disease is diagnosed about 45% of the time. What can family members do to increase an early and effective diagnosis? And then I wanted to add to that, why does it help to diagnose it early if there's really no cure? So who wants to take that on? So this question is how to make sure your family members get diagnosed correctly.
Well, before I answer that question specifically, I do want to point out, as Dr. Shomo said, there are different types of dementia. Alzheimer's dementia is the #1 cause of dementia. Vascular dementia is another type of dementia, and that's the type of dementia that is particularly exacerbated by some of the things Dr. Shomo just mentioned: hypertension, diabetes, et cetera, et cetera. And so I think that's where the confusion may come in a little bit. However, there's another type of dementia, Lewy body dementia, that has now surpassed vascular dementia and is #2. So sometimes we lump.
Sorry, Dr. Austin, tell us again, what is #2?
#2 is Lewy body, L-E-W-Y, Lewy body dementia.
L-E-W-Y, Lewy body. Okay, I've never heard of that. That's something new.
Yeah.
I didn't interrupt, go right ahead.
And the folks at the Alzheimer's Association, they are very familiar with Lewy body dementia. And #3 is vascular dementia, as I said. And there are other types, frontotemporal dementia, et cetera, et cetera. So there are a whole bunch of types of dementia, and they may have different presentations, clinical presentations, and we're often able to differentiate it by clinical presentations. Now, there are neurologists at University of Cincinnati who are now checking for biomarkers. So they're doing lumbar punctures on individuals with dementia to help differentiate what type of dementia it is. And so they feel that identifying the type of dementia may help with coming up with better treatment for Alzheimer's dementia and other dementias.
All right, thank you very much. I learned something new. Lewy body was something I had never heard of. So thank you for that. And so here's another question. And organ donation panel, we're getting to you. Don't worry. There are questions coming up for you as well. This one is, what does the Alzheimer's Association do for families, and is there a charge for its services?
I can jump in on that one, Jan.
Okay.
There's several things that the association here specifically in Greater Cincinnati does, and it's part of really a national initiative. To the first question, is the services are free. There's a 24/7 hotline that you can call. And actually, if you just do alz.org/Cincinnati, there's actually a layout of the different virtual library, help and support, again, the 24/7 hotline, and the different initiatives that are out there. There are some things that have changed due to COVID, unfortunately, through the social work and the community groups that they have. But that is a great place for folks to start. And again, that hotline is 24/7 and is completely free. And they can get you in touch with folks like Dr. Austin and Dr. Shomo, who are experts in the field, to help along that process as well. And that's really where its value comes into play.
Okay, great. Thank you so much. And so the other question here, I think we really answered that. And is there anything we can do to reduce risk for developing Alzheimer's? And I know Dr. Shomo and Dr. Austin both touched on that. I don't know if you wanted to add anything.
I was just going to say that, so most people have mixed Alzheimer's and vascular, so that's what makes it kind of weird too, is a lot of people can have a little bit of both. So it can be hard to really say, completely which type it is. And there's not really the best test to determine, which is which. But we generally, if we know people have a lot of health conditions, we try to manage them. It's all, just for all types of reasons, for their kidneys, for their brain, for their heart. So, we try to manage chronic illnesses to help people, live disability-free lives as long as they can. That's generally what our goal as geriatricians is trying to help people live, have a good quality of life for as long as they can. And so that's all I would say in addition to that.
Okay, that's great. Thank you.
And
I wanted to say
real quick.
Oh, okay.
Real quick, Jan, if we can just at either right now or at some point, can we have the doctors maybe touch on, I think it was a question earlier about the importance of early detection for Alzheimer's and why there's a lack of that. I understand, I think there may be an understanding for the masses as to why it's delayed on people reporting it, a little bit of anxiety, maybe not recognizing the signs, but could, if we can't at this moment, circle back to have the doctors talk a little bit about why that is important to diagnose early.
Okay, well, Keith, let's circle back to that because Dr. And I wrote it down and make sure we don't forget. Dr. Kent Robinson has joined us. And so, Dr. Robinson, did you want to say a few comments, and then we're going to talk a little bit about organ donations?
I don't see him on here anymore.
Oh, did he pop back off?
Yeah, he popped off. So we're working to see if we can get him back.
He was on for a minute. I saw. Okay. All right, Dr. Robinson. I promise he's coming back. Okay, but let me go because Andy, you mentioned that people of color are suffering at a higher rate, and you were saying how the coronavirus has also influenced the need for organ donations. Can you just tell us more about that?
Well, with respect to the coronavirus, the issue as it relates to transplant is that many transplant programs were suspended when coronavirus came on. Simply because there was the need to have more beds available for patients suffering with their battling the coronavirus. The other aspect to this is kidney patients were kind of put on pause. Those patients that were waiting to receive a transplant during those first few months, those transplants were delayed because anyone who was receiving a kidney transplant, that was not viewed as being life-saving because those patients could continue on dialysis. Dialysis is not while it's a treatment for kidney disease, it's really not something that you want to have to endure long term, as it is really stressing on the body. So I think those are the issues as it relates to COVID and transplant. The other aspect is patients that passed away as a result of COVID could not be considered for organ, eye, and tissue donation because they were active with the virus. So that also had an impact with just the ability to save other people's lives as a result of donation.
So I'm really surprised that you said hospitals weren't seeing kidney transplants as something essential. And then I want to get to Idris Gray to talk about that, because you started saying, you were telling us a little bit about what it's like being on dialysis. So tell us about that. You were on dialysis for what, 4 years before you had your kidney transplant?
Yes, I'm actually back on dialysis. I had a kidney rejection. It started last May, and I was going through apheresis treatments. You know, these are to really increase your antibodies, and you know, the kidney progressively began to reject, and I'm back on dialysis now. But the first stint of dialysis was 4 years. I had to go through a workup to get on the transplant list, and after that, it took about 1.5 years to get on the transplant list. So about 2.5 year wait to receive a kidney. But for African Americans, there is a lot of taboo behind organ and tissue donation. You know, there are religious beliefs. There are beliefs in terms of, if I do become an organ and tissue donor, are they going to work as hard to save my life if I become critically ill or in critical condition? So it's very difficult for African Americans and the African American community to become organ and tissue donors. So that's why we have to, as Andy said, dispel those myths, because it's very life-saving, and we are the ones who are in need of organ and tissue and donation the most. So that's why we really push it hard to get the word out about it.
And so Andy, what are these fears? Mr. Gray mentioned there's some religious reasons. What's stopping us from being donors?
I think first and foremost, what stops us is people that there's difficulty in discussing our mortality as human beings. So I think that's first and foremost. But I also think that as it relates to people of color, there's some historical issues there. There's some things that have happened in our history where we've not been treated with equity in the healthcare system. And so I think that also plays a part. Often what I hear when I'm out at community events talking with people is, doctors won't do everything they can to work to save my life if they know that I'm a registered donor. That's absolutely false. A medical professional. Yeah, and we have several medical professionals on the panel today. Their only responsibility is to save a patient's life. And so it's not until death has been declared that donation even becomes a part of the conversation. So that's first and foremost. Religion as well. People say it's against my religion. The fact is all major religions support donation as a final act of giving. And if you really step back and think about that and measure that with your faith, that makes sense. So those are probably the top two that I hear the most. Another one is I'm too old, or I've had X, Y, or Z health condition. So that definitely rules me out. I would encourage people, don't rule yourself out of that process. Everything is determined at the time of death, and a medical history and evaluation is done. But there's been so much progress in transplant that people who have been cancer-free for 5 years and not had treatment have been able to be donors. I mean, so there's a lot happening. And so I just really encourage people to inform themselves. And visit our website at lifepassiton.org. There's a lot of great information. And then also just talk to people who have been through that journey, either as a recipient or as a donor family, because there you're getting firsthand information about the impact of donation.
And then here's a question from Audrey Holtzman, who's asking, what are the benefits of receiving a kidney from a living donor versus a deceased donor?
So the long-term effect is that is more beneficial, if you will, or the longevity of the transplant has the potential to be better than that of a deceased donor. The other part of living donation is if you receive the gift from a living donor, then those other 100,000 plus people that are waiting, then that offers them an opportunity. So I think living donation is just something that, people should consider if they want to get more information about it. It is a wonderful way to help others, someone you may know or someone that you may not know. People can function well and have no issues with one kidney. That's another thing that people may not realize.
And then a lot of times I think people say, well, you can ask your family. I mean, you're more likely to match with a family member, but that doesn't always work. And I mentioned a friend of mine who has a twin sister, but her twin sister had some heart issues and couldn't donate her kidney. They did find her niece eventually, but sometimes, they just happen to have a really large family. But people, have to realize there are a lot of times there is no family member. So Sarah Greenmore, and you mentioned your donor, that you and someone else both had the same donor.
Yes.
So tell us about your journey to, what was happening before you got to that point.
Well, before I got to that point, my doctors really actually had to catch me because I was in denial that I was going into renal failure. Because I didn't have any of the symptoms that I guess everybody would normally display. I did not display that. I felt fine. I was my Zoom self. And then it got to a point where my doctor looked me in my face and said, you can't run anymore. It's time. And so at that point, reality did hit me, because at the same time, my mother was transitioning. So I was thinking more so now I have to stop thinking about me and start thinking about my family and what this would do to them with my mother transitioning and me going through what I was going through. So I hunkered down and went through the process, and it was not an easy process. It was not an easy process. Like Idris was saying, being on dialysis, it's hard. It's really hard.
It's physically hard, isn't it? I think it's like, not just
and it's hard. And it was mentally hard for me because as a person, for me, having to depend on a machine to keep me living was really hard to deal with for a while. It was really hard to deal with for a while. And when I went through my first procedure, that was really tough. I mean, that was really, really tough, actually being hooked up to a machine, looking at this machine and saying, this machine is keeping me alive. Yeah. And then me saying to myself, I know this is not my story. This is my part of my journey to whatever the end of my story may be, but this is not my story. And so I say to anyone that's having to go through dialysis, you have to keep a positive outlook on life. I had to get to the point where I was, I would tell my family, I'm good, I just need a kidney. That's it. Other than that, I'm fine. I'm still Sarah. I'm still your Sweetie. I'm still your Amy. I'm still whoever it is I am to you, So it was a journey. It was lessons learned. I would not change anything because my journey led me to this point. It led me to another sister, another family, including the donor family, whoever that family may be. To this day, we don't know who that family is. And every day we like to say thank you to that family for their selflessness in allowing both of us to be alive and flourishing today.
And Sarah, could you
Beautiful.
tell,
And Sarah-
when did you, I just wanted Sarah to say when she received her transplant.
December 15th, 2017.
2017.
All right. So it's been 3.5 years. That's great. That is wonderful. And then I wanted to share a comment from Robert Brown, who's made a few comments here. And he also says hello to Dr. Austin. He said, I was a bone marrow donor and campaigned for the National Marrow Donor Program. I discovered that brothers under-participate in donor activities, therefore stranding many needed minority recipients. So a bone marrow donor, what does that entail? Is that something everybody can, or most people can do?
So bone marrow is different from organ, eye, and tissue donation. And there is a test that is conducted. I believe it's a swab test. Is it swab? And you're then placed on the registry. I do believe that there is an age limit, or there's a certain age where you could no longer be a bone marrow donor. So that's, once you're in that registry, you could potentially help someone through bone marrow donation.
Okay. And then Robert Brown had another comment here. He says, Black men are 3.5 times likely to be dialysis patients, or more likely to be dialysis patients than white men. The primary causes are hypertension and diabetes. We need to control these comorbidities. Would any of the doctors like to comment on that?
Dr. Austin, you're unmuted if you want to comment.
Yes, actually, when you think about many of these risk factors, they apply to so many different conditions, including COVID-19. Black individuals, African Americans in the state of Ohio are three times more likely to die from COVID, and 6 times more likely to be hospitalized. So a lot of these, what doctors refer to as vascular comorbidities, impact so many different things in the African American community.
Wow. So here's another question. Let's see, let me get up here. Just want to make sure I didn't miss that.
Can I just say while you're looking for that, that a lot of what people are seeing right now is kind of this whole coalescence of COVID and all these other health disparities and how systemic racism impacts them all. So when we're looking at a lot of these, it's just a lot of people who neglect their health, or they don't have a lot, look at our neighborhoods. Do we have grocery stores in our neighborhood? Do we have fresh fruits and vegetables available? Like, we talk to our patients about getting fresh fruits and vegetables, but do they have access to that? Do they have the income to be able to afford, to buy vegetables, or time to go buy vegetables every other day? Because, usually you need quite a bit of vegetables unless you're going to freeze them. But so there's just a lot of things that go into that. A lot of people, a lot of young people, they don't realize. So I take care of a lot of hypertension patients. I take care of all ages. So, but a lot of my young patients, especially men. So June is Men's Health Month. They tend to be so busy working that, a lot of times they're just like, I'm fine. And we call hypertension a silent killer, because, people can be feeling fine. They don't know that something is happening. And so, our job as primary care doctors, Dr. Austin and I both do primary care. He does primary care and nursing home work. I used to do nursing home work, but now I mostly just do primary care. So we all day long are talking to patients about making sure they take care of themselves. And that is one of the biggest things that we have a hard time with. And part of it is just, part of it is a systemic racism, that we don't have the income. Sometimes people are working 2 jobs to be able to make ends meet. So how do you have time to go to a doctor? How do you have time to go get your medicine? How do you have time to cook? You know what I mean? So it's just a lot of things that we're looking at all together right now that are pretty much part of the same thing.
Right. And we've got in such a habit of driving by fast food places and, grabbing like high sodium foods. And that's not really helping us. There's some questions here. I want to go back to Alzheimer's. There are several questions here about caregiving. So one is, how can caregivers care for their loved ones with dementia and Alzheimer's? And it's kind of related to, well, we'll let you ask that, but I'll just tell you the follow-up question is it safe to hire help in the home when you're caring for a person with dementia? And I think that has to do with COVID. They're saying, what do the doctors suggest to maintain safety at home with COVID? So let's just go back to, how does one care for their loved ones who have dementia and Alzheimer's, which is very, very difficult. Any suggestions from doctors or panelists?
Well, it depends on, number one, on where the patient is located, where your loved one, your family member is located. If they're in a nursing home during the pandemic, honestly, they may not even be able to visit. Governor DeWine has certain rules in place for long-term care facilities. So unless someone is actively dying, they may not be able to even visit their loved one. So it's a very difficult time. There are lots of questions that should be asked if your loved one happens to be, say, Alzheimer's dementia in a long-term care facility and you're worried about COVID. You certainly want to ask the nursing home personnel about personal protective equipment. You want to ask them about testing for staff and other folks who enter into the facility. So we have to be really diligent, and we should feel empowered to ask those questions, even if we're not able to visit the facility. Ask about social distancing, ask about, I alluded to personal protective equipment, and remember face masks are part of that. So you want to ask about face masks universally required for all employees at your facility.
Yeah, I'm sorry.
As it relates to taking care of someone at home, that becomes even more difficult because, number one, are you able to take care of your loved one at home if they have dementia? And number two, because of the COVID pandemic, taking care of your loved one at home potentially has become so much more difficult because how many family members live in that facility? For obvious reasons.
Bringing in someone from the outside, and you don't
bringing
know
in someone from the outside. So exactly. So hiring help, you want to do the interview process. If you're using a home health care agency, what are their protocols, what are their, et cetera, et cetera. So it's really a difficult time. The one thing I will say as it relates to the Alzheimer's Association, on their website, they have really valuable information about this. So I'm sure Trey or Keith can speak to that.
Absolutely. Thank you, Dr. Austin. I think most of it, and you're absolutely right. Number one, on our website, even if you just go to alz.org, we have a significant amount of information regarding COVID-19. We actually recently did a statewide town hall really around home care and hospice, because we were hearing from individuals taking care of loved ones at home that needed additional support. They were scared that if they let someone from the outside in the home, they would bring COVID with them. So in hearing that, we reacted and said, okay, let's get on the horn with the association and leading it across the state. And they assured everyone on the call, number one, PPE, while it was difficult to get at a point in time, they're where they need to be now. Testing is a top priority. And everyone that is entering a home that works for a home care agency has been tested. There's still other things that, there's still unknowns. And there's still things to look out for. So I don't want to say, yes, everything will be perfect, but I will say that,
they need to make sure they're following those protocols.
Absolutely. I mean, and to Dr. Austin's point, ask the questions, and going back even to long-term care facilities, the state is actively getting that information back on facilities that have been impacted, and they're publishing that information on the state website. So, so that's a prime example of literally, if you are concerned about a loved one in a facility, now facilities are mandated to publish that, or basically to report that information, and the state is going to reactively publish that. That's tremendous, and I think everyone's continuing to be nervous. The likelihood of nursing homes opening back up anytime soon is not likely. Ask the facility, hey, can we do a virtual visit of mom or dad or loved one to see them at a bare minimum and coordinate that with that facility. Those kind of things are helpful. But again, it's just a very dynamic situation across the state. We've been talking to state leaders almost weekly to get an understanding on what's going on. There are some assisted living facilities that are allowing outdoor visits from loved ones. So that may be an option. But, and again, as we look at the numbers start to creep back up in Ohio, there may be a reaction to that as well. Right. So I think there's just a lot of movement right now in a very fluid situation. But, definitely the Alzheimer's Association has the resources needed to really educate. And I would say the Cincinnati chapter, and Keith can speak to this probably, just they do an exceptional job in making outreach to the community and really providing resources.
Okay, thank you. I want to get to this next question because we're getting, oh wow, the time is just flying. But here's another question. How long is the duration of Alzheimer's? Some seem to die quickly after being diagnosed. Others live a long time. My aunt lived about 15 plus years after being diagnosed.
Yeah, so it differs. The average maybe 7 to 9 years or thereabouts, but we have folks in the nursing home who live for 10 to 15 years. And on the corollary is true. We also have some individuals who die relatively soon after a few years. So, but the average is somewhere between 7 to 9 years or thereabouts.
Okay, and now's a good time.
Go ahead. I'm sorry, Jen.
No, I'm sorry, Dr. Austin. You go right ahead.
I just wanted to get back to Keith's a really important question briefly. We don't have a cure for Alzheimer's, but we do have treatment. So there are medications that can be tried. So avoiding the physician is not the answer. Also, we have a wonderful organization, and I don't get a kickback from the Alzheimer's Association, but they truly are a great organization. And one of the first things that I do when I diagnose someone is refer them to the Alzheimer's Association.
And I want to say my aunt took some kind of medication. I think it was called benzapril. You guys might have to correct me on that, but it was like a little pink pill.
Well, the most common medicine early on are
the memory loss. Yeah.
Yeah, but there are medicines that can be prescribed.
That can slow it down.
Can I just say too, because somebody asked about, 45% people are diagnosed. A lot of the reasons why people may not be diagnosed is because they may be living alone and people aren't there to help notice the changes. So I think that's one of the biggest things is when you know you have people in your family who are aging, to check on them often and to, see what's really going on, because sometimes people can really seem like they have it all together, but you ask them questions like, what day is it today? They don't know what day it is, so, just asking them. I remember, I worked with Dr. Austin. He helped train me throughout my residency and through my fellowship. So I remember working with him as a resident, and there was a patient who, was just talking about the weekend, and he was like, she has Alzheimer's. And he was like, did you ask her what day it is? And I was like, no, so it's just one of those things where sometimes people are really good at hiding it. And then also the other thing is, so when we talk about treatment, we talk about medicine, but our biggest concern is that people be safe. So, people who have Alzheimer's or a lot of memory issues burn things on the stove. They get into car accidents. So it's important to diagnose it early so that those safety issues, because now I teach medical students, so that's what I teach my medical students, that the safety aspect of it in a treatment plan is one of the most important things that we do in care planning for Alzheimer's patients or dementia patients.
Yeah, that's pretty scary. People living alone who might leave the stove on or something like that, that can be life-threatening. So here's another one. I love this question. This person is anonymous as well. And he or she said, I know an Alzheimer's caregiver who has really been stressed out even more than usual due to not being able to get out during the current pandemic. Any advice on what she can do? That's a great question.
Well, I know it's somewhat redundant to say to contact the Alzheimer's Association, but there really is a ton of value in there with their support groups and helplines. Because what they do is also build a network of people, again, kind of skating back to the issue of bringing people into the home. These are unique times, and so there are various things that are by trial and error, and some things that are constantly changing because, as we all are aware, we have no national leadership on how to deal with this pandemic. So all these individual groups, be it local or state level, are having to piece this together. And so I think that when you look at someone who's a caregiver, that's also a reason why it was so important, I think, to piggyback on what the doctors were saying about early diagnosis. Helps you build the community because the caregiver is in many ways as affected by this disease as the patient in this case. So a lot of times they get burned out and aren't able to develop a routine themselves. In the early stages of Alzheimer's, and the doctors can correct me if I'm wrong, because I only took one biology class in high school, and is that they have a situation where in the early stages, they're still functional, can watch TV, can carry on a conversation, can go for a walk, can do those things. So having someone watch them, quote unquote, isn't the challenge of someone who is not able to walk on their own, not able to feed themselves in those situations. So again, not everybody has necessarily a way out because we are in different and unique times right now. But a lot of it is sometimes being able to contact the association. They can help build a network for you and have folks that can lean on and watch and spend time with that individual for you, even if it's just you going to the other room to sit for a second and breathe for a moment.
And that's so important. Caregivers have to take care of themselves too. If you don't take care of yourself, you can't take care of your loved ones. So it's very important. We're going to give the last question will be about organ donation. And it's from Audrey Holtzman. And Audrey, thanks for all your great questions. And this one is, can a person receive an organ if they are not on the transplant list?
They cannot. People are placed on this national waiting list. And as I mentioned earlier, there's about 114,000 people waiting for a life-saving gift. So you do have to be listed in order to receive a transplant.
Unless you're getting it from a family member, is that right? Like if a family member chooses you to donate a kidney to, for example, you don't have to.
Yes. So yeah, if you were identified as needing a kidney transplant, for example, and tests were conducted and the workup was completed and that person was a match, then yes, that would be the case. They would not be listed. That is correct.
Well, you have all provided such great information and attendees, such great questions and comments. We really appreciate it. I just want to mention before I throw it to Renee that we do have COVID-19 communityresources.com. I know we partner with the Alzheimer's Association of Greater Cincinnati as well as the state association. They'll all have information on our website, and we'll have links to their website just in case you didn't write them down, as well as the Life Donor Center. So thank you, all of you. You've been so fantastic. And we're going to give the last few words to the president and CEO of the Center for Closing the Health Gap, Renee Mahaffey Harris, who makes all of this possible. Thank you, Renee.
Oh, thank you. Well, thank you for being our moderator in part 12 of our town halls. I want to thank all of the panelists today. It was incredible information and we could have gone on for much more time. So please make sure you get it to us so we can get it posted on COVID-19 communityresources.com. That is made possible by powering by the Closing the Health Gap, but our partners in the Urban League of Greater Cincinnati, Eddie Cohen, the African American Chamber of Commerce President, Eric Kearney, the first vice president of the NAACP, Joe Mallory, and the Cincinnati Medical Association. Dr. Robinson had some technical difficulties, but we will have him back another time. And I really thank you. I think what's most important in what each of you said is that we as Black people are disproportionately impacted by the conditions in which we live and the systemic structural racism that we are now hearing about, but we have lived for decades and centuries, are the reason. And so I thank you for each of you sharing that information. Information is key for us to turn the tide, because we will live longer as we learn more and we are able to do more, have more preventative advocacy around the barriers that we don't directly control. So I thank each of you. I also want to say that COVID-19 numbers are spiking. I'm part of the Minority Strike Force along with Dr. Odell Owens and Vice Mayor Smitherman, as well as our Commissioner of Health, Dr. Moore. There are testing sites that are going to be posted and moving forward really rapidly. One that I want to mention to you, beginning Monday, June 29th, there will be a testing site in Mount Airy at 2730 Coleraine Avenue. We will have information on the sites that will continue to pop up over the month of July so that we have greater access for everyone to testing. So mask up, social distance, and wash your hands, and we are going to get through this time together, and God is going to see us through. So I thank you all for today, and I thank you, Jan Michelle, and I thank you, each of the panelists for joining us today with such incredible information that we need to save our own lives. So thank you, and you all have a great rest of the weekend.
And we should say we're taking a break next week, so stay tuned. We'll be back soon.
Thank you.
Thanks, everybody.
Thank you. Bye-bye. Thank you. I always have difficulty ending.